Hey, everybody. It is Glaucoma Awareness and Eye Health Month this month. Eyes, you only have two of them, and they are both really, really important. Nurse Mark, what is glaucoma?
Good question, Sherry. So, glaucoma is a group of eye diseases that gradually steal your sight without warning. So, the vision loss is caused by damage to the optic nerve, and it's related to intraocular pressure, the pressure inside of your eye. So, your nerve acts like an electric cable with over 1 million wires, and it's responsible for carrying images from the eye to the brain. And there's two types of glaucoma, Sherry. There's primary glaucoma, which is also called open angle glaucoma, and that's an increase in that pressure. It's sort of like high blood pressure in your eyeball. And then there's secondary glaucoma, and that's when another disease contributes to increased eye pressure, and it results in damage to that optic nerve, and that's where you get the vision loss. So,
Yeah.
Sherry, what are some of the risk factors?
Well, some of the risk factors are African, Asian, and Hispanic descent,
Hmm.
generally men and women that are over the age of 60 years old, extremely nearsighted people, and people who have diabetes, like we had talked about.
Hmm.
So prevention, Mark, what are types of prevention are we looking at here?
Yeah, so you need to catch this early before you start experiencing that vision loss because it's irreversible, right? So it's prevention, Sherry. You really need to have regular eye exams, annual eye exams. And so glaucoma is the second leading cause of blindness in the world. It's not something to mess around with. So the real thing that you need to do is prevent it. And that's with
Yeah.
comprehensive eye exams and to start treatment right away. Because there's
Yeah,
no symptoms, Sherry, right? If you have
right.
if you have glaucoma, you might not notice it until you've lost that vision. And so, Sherry, is there a cure for it?
Well, no, there is not a cure. However, not, and this is even with laser surgery, which I had. We need
Mhm.
to make sure that the holes in the eyeballs are still open. So basically, like I said, there's a lot of different things that contribute to
Mhm.
glaucoma, but there are a lot of other things that can help with it. So medication is to slow or prevent further vision loss.
Mhm.
Surgery, they do surgery. There's a new surgery that they do that's called laser iridotomy. And so it
Right.
adds another hole for drainage if the eye fluid pressure gets too
It's
high.
about getting that fluid out of the eyeball. It's a regular circuit, so it needs to drain.
Yes.
Mhm.
Treatment can also include cannabinoids and terpenes, complementary, not as a replacement for traditional treatment.
Right.
So, medical cannabis glaucoma ranks among the most frequently cited reasons for using medical cannabis. And it's one of the indications for which the federal government granted permission for compassionate use of cannabis.
Mhm.
1970s research showed that cannabis does reduce intraocular pressure.
So what do the studies say? They say, yes, cannabinoids do reduce intraocular pressure as well as most conventional glaucoma meds. They work very well. So
Yes.
taken orally, intravenously, or by inhalation, interocular pressure was reduced. Application to the eye directly did not lower the intraocular pressure. And most trials demonstrated the pressure was only relieved for 3 or 4 hours
Mm.
after taking cannabis orally, intravenously, or via inhalation. So the problem is consistency. So what should
Yes.
you do, Sherry?
If you think about it, glaucoma treatment is 24 hours a day. And for some patients, it's unrealistic for them to consume cannabis every 2 to 4 hours. So I truly think it's the combination of traditional and cannabinoids that can be very, very helpful if patients choose that. So
Mm,
conventional medicine is drops twice a day. So
mm,
that seems to be a little bit more realistic for patients, especially when it comes to time, when it comes to expense, and when it comes to being able to consume that many cannabinoids to keep the pressure significantly low. So the other thing that glaucoma treatment for cannabis is that they actually looked at cannabis tinctures for direct eye application.
mhm,
And currently, it's not an option yet. You can't do alcohol or glycerin tinctures in your eye.
mm,
Oil based tinctures do not absorb and are very irritating to the eye. So we need a water based tincture, and then it would need to be studied for the appropriate dosage, when to give it, how
mhm.
much, and when, how often. So we can't solely rely on cannabis due to the various factors, including past medical history, other medical conditions, drugs, lifestyle, age, and the ability to consume that much, as well as being able to afford it.
Right. And a study at the National Eye Institute, which is a division of the National Institutes of Health, said that cannabinoids, specifically THC, could be safely used to keep intraocular pressure lowered, but it only lasts 3 to 4 hours. So the issue becomes keeping a steady amount of cannabinoids in the system to have the effect. Now, the
Yep.
American Glaucoma Society is reluctant to recommend cannabis as a treatment modality because of the short duration and the need to be medicated around the clock for glaucoma. The side effects of THC are a little too much for people to handle, and the lack of really conclusive evidence that it alters the course of glaucoma. And so they don't recommend it as a sole treatment. Does this mean that you shouldn't use it? No,
No.
but just don't rely on cannabinoids alone.
Right. Absolutely. So cannabis and glaucoma. So there are many different cannabinoids, but the science and research has shown that THC is the cannabinoid that works at decreasing pressure. So
Mhm.
when we think about whole plant medicine, we can also think about adding other cannabinoids to mitigate side effects of not being able to tolerate other high doses of THC. So often we see patients that use a combination of whole plant, THC dominant, with the supporting CBD and CBG components to support the entourage
Mm,
effect. Primary terpenes that may benefit glaucoma. And then when you see the interaction between terpenes and cannabinoids, magic happens. So
mhm.
the primary terpenes that may benefit glaucoma are pinene, caryophyllene, limonene, myrcene, in some cases, humulene. So that's very interesting. We learned. And then,
Mm.
Mark, what about the methods of administration?
So, Sherry, it's the normal methods of administration with one exception. So you have capsules, edibles, gummy, tinctures, smoke. But again, as you said earlier, you can't apply it directly to the eye. It's just not there yet. And so there's work to be done.
There's work to be done. So,
Mm.
this has been a special Wellness Wednesday edition of Nurse Mark and the Green Nurse. Stay tuned for next time.